So this is my end of the semester reflection for the spring and about my clinical goals that we created in the beginning of the year. And overall, I know with these goals, it's just something I need to improve on too, is just writing them. It's still for me to getting used to like writing goals and really thinking and reflecting them. So that's something that I need to improve on for next semester whenever we next do this. But before going into specifics of these goals, just looking back and reflecting about the progress that I made or if there was any progress that was made. I never realized how much time and dedication is needed to make a conscious change. I know we talked about that a little bit during DAT weekend, and that will be talked about a little bit more during my action plan of just being held more accountable. I feel like will make me realize that these goals exist and kind of help me reminder, oh yeah, I did write that for assignment over in the beginning of the semester. So, just hopping right into it for clinical goals. I wanted to improve my documentation process before it was really bad during the fall. Um, Overall, it's been better for like the first half of the season, and then during season, I think it kind of trickled down a little bit. I still need improvement. I think my problem is that I document well for injuries that are like doctor seeing or season ending or they are just out of practice. So true definition of an injury. However, I mostly deal with like maintenance issues or like they're still competing, however they're still coming to treatment and their practice isn't really not limited, but it's not necessarily an injury, it's just soreness. And I think my problem is that there's no an REMR, there's no soreness option, and so I just don't know how to document it in sportswear. Because it's to me, it's not a true injury that's occurring. It's maintenance issues, and that's something I just need to talk with Cody about. About hey, is there a way to add soreness, or how do you want to track soreness? Because to me, I'm thinking it's not technically an injury, and then if an injury does come arise, just give a brief summary of what's done. But at the same time, we are still performing treatment on them. So I think that's just something I need to talk about. But I still encourage my students. My rule still stands of if they do it, they document it for injuries. Just trying to teach them good habits of like, oh, or just at least like write it down for them and seeing as we edit everything for them. But that's with documentation. Overall, it's better, but yet I'm still going back to unfortunately, back to my old ways that need to change. My other goal was about manual techniques. I have kept in mind, this is kind of what I said before, I kept in mind what I learned, however, I didn't practice it. I'm still stuck on my old methods of dealing with things, and it stinks because it's like I want to change my habits. And again, it's like I needed that time and dedication of these skills to realize that hey, it won't change overnight. You can't just say do it and then done. I really need to work on it and focus on it. And it just stinks that I didn't get to do that. And also I didn't have that many people with some back issues. So it's unfortunate that I just didn't really remember that I could be using those techniques that I learned in classes. So moving on to educational goals. I know I messed up with the education goals beginning with, and now I understand what needs to be done with this section. But what I had was learning more about lower back screenings. Because I know in the fall I had a ton of back issues, and I thought, oh, maybe it's just like core or just treat the symptoms. But I have learned a little bit through classes and something that I can really implement most and maybe think about for the fall of how I can implement the prevention plan that way. And then pitchers arm care, I want to learn more. I have learned more through doing it and reevaluating assessments, so clinic patient outcomes. And so it's just how I just self-evaluate for myself and then self-evaluate of how like the pitcher is doing, for instance. If something doesn't work, we try something else, and then I tend to try it with other people if they qualify with it, and it seemed to be helpful a lot. Actually, it's like I've been starting to use more of like joint mobs and capsular related issues and active releases more to help them get back, and they've seen quicker results with it. I've also used, we had a couple double headers, and actually the last one I used Compex. I know, not research, but out for it. But I used the active recovery for a closer that needed to be ready for the next game, and he had to be ready. So I was like, let's just slap this on right away. I read one research article about it, and on their website, and he said his arm never felt better the second game than it did the first game. So that's just something that I just use self evaluations for. But I could definitely improve by, again, being more attentive in what these goals were. For scholarship, I wanted to improve my leadership skills. I feel like as I'm being more comfortable in my position, my leadership skills with my students have getting better once I get to know them and what works and what doesn't work. So I do see improvements with myself of being a leader, making sure that I tailor their needs and design specific tasks for them to do to make sure. For instance, I had my senior student just say, hey, you're going to hold the head, or I had my junior had to set up, but yet we were just not doing anything. So he had to figure out that they had to tell us to ask for help. So I'm finding these little things to do it, but through like the leadership speaker series especially, that I feel like I've help improve my realize of what a leader can be, and it doesn't have to be large scale, it can be small scale with preceptorship. Weakness is like, my assertiveness, I notice sometimes it's there, sometimes it's not. It really depends on the day. And then just making sure I say my opinions. I'm always feared about the reason why I don't say a lot of what my thoughts are or not participate as much is because I always think out my answers, but then I am always feared about being judged about my answers too. So I think that's just something that, to move on to the next step, you can't care about what people are going to think about you when you make decisions, and I know that's a big roadblock for me with just my whole life. So time management, it's better. It's getting there, but I actually do better when I'm more busy. So when I was traveling, I was a rock star at it and making sure I was going through the whole week of it. But however, I still took things last minute, but I feel like it's slowly getting there, but basically staying the same except when I'm traveling for like the weeks. And then all of a sudden I'm like super focused because that's the only thing I can do. So for my action plan, again, to be honest, we talked about this a lot about DAT week and about holding each other accountable for these goals, and we don't, I'm a victim of that. I didn't remember really much of my goals. I kind of knew what they were, but I didn't have the attentions of, hey, these are my goals, I should actually do them. I wasn't held accountable, so it would be really awesome if that was held in place for the semesters to come, of just these bi-weekly checkups of like, hey, how you doing? What's your goals? What can I do to help you? Because I feel like it will just make sure that everyone understands of, hey, these are your goals. You should really do that, and just be kind of a buddy system. And also I was more worried about my students' goals than my own. So I feel like I need to still care about their goals, but however, I need to be more care about my goals as well, whether it's asking someone if it's not implemented in the program, ask someone, hey, can we just chat for like 2 minutes every day or 5 minutes every week or whatever, every other week, and saying, hey, how are you with your goals, being held accountable. That will really help me as well. So these action plan for next semester. This summer I will not be practicing as an athletic trainer until August, and since I'm working at a day camp, but so this is my action plan for the summer based on those reasonings. For documentation, I feel like it has to be adjusted because it has to get better. This will be done in the fall, but I really just needed to set the rule like I had in undergrad of waiting, of taking the time at the end of the day to do it and not leave until documentation is done. That's my rule was in undergrad, and that's what I was held to as being accountable, and I have not done that to myself. So I feel like I know it's success. Once it's successful, and two, it needs to be get done because it's ridiculous of me not getting it done right away. So I'm kind of frustrated with myself that I'm always behind on documentation. And also just I continue to utilize students and continue to challenge them and continue maybe next time not necessarily have the role of you do it, document it, but also, hey, dictate what I'm doing. like seeing what you have and then dictate. That might be something else I can do in the fall. I would also, for changing like clinical habits, like the screening preventions, pitch arm care, manual techniques, is really just take the time in the summer, like once a day, or like once a time, like a, one day per week or whatever, of just looking and seeing how I can improve my clinical practice based on like what the literature says. Whether it's treating, like probably for treating low backs, of like prevention programs, or what we talked about in our research meeting about upper arm screening tools, of just taking a day, not a day, but just taking time out of a day just to look up stuff, and then just seeing what arm care techniques I can do to help specifically with my practice as well, of through like journals or the PBAP's website. Just actually like using my summer as gathering what I can improve on for next year and finding that tools and research for that. Leadership, I feel like this summer will be a great time to improve my leadership skills, because I am in a leadership position at a location, a job that I'm really comfortable with. I've been a part of it for 4 years before I came here, 3 years, excuse me, before I came here. So I feel like I'm comfortable in that position. However, I'm also working with high schoolers and middle schoolers, so they're going to challenge me with everything, and I have to say my opinion, and I have to be assertive with them because it won't get done. So, um, so I feel like that will be a great time to just kind of step out of my comfort zone and really just make sure, if I have something on my mind, make sure it's appropriate time and take the appropriate actions to say it, especially being in the leadership position, and just really talking through, like I have my bosses saying, hey, help me if I'm not assertive enough, or hey, can you just watch me as I'm having a serious talk with middle schoolers about what to do and what not to do. Just kind of have another opinion to see what I can do better on the leadership side of things. So time management needs to be improved, and this summer is a great way to improve it because I'm working a full-time summer job as well as taking these classes, so I need to create a schedule for my work, my school, and my life for my sanity. I feel like I just need to purchase a planner and use it. I have one, and I just haven't used it, so I just actually need to open it up and write in it. So I feel like that's it, and just make sure that I scratch out the time allotted and talk to my boss and saying, hey, I gotta miss like an hour this time in the day, and then can I go in an office and just work for an hour on my schoolwork, and they're pretty good about that. But overall, I think the big thing I need to do in the action plan is being held more accountable by my peers about these things, and that realizing that, hey, like it takes time and dedication to change habits, and hopefully this is an eye-opening experience, not just for this video, but for like the next semesters to come in the summer. So that is what I have to say for the for this video.